Thank you for being here. Today we will be sharing UN Women's response to the Ebola crisis. We will hear from two of our colleagues in the field, Peterson Magola, UN Women Deputy Representative in Liberia, followed by Mary Okumu, UN Women's Representative in Sierra Leone. They will share their experiences from the field and describe their efforts to respond to the Ebola crisis, working together with the rest of the UN system, government, civil society, regional and national partners. As you know, UN Women family lost one of our dear staff members to the virus. Edmund Cissé, our driver in Sierra Leone, passed away late last year. And you also heard our executive director sharing with you the message that she had received at that time from our representative in Sierra Leone. The current Ebola outbreak is the deadliest on record. Its spread has been unprecedented and represents an extraordinary public health challenge for impacted countries. As of February 2nd, there were 22,500 confirmed, probable, and suspected cases of the Ebola virus disease in the three most affected countries, Guinea, Liberia, and Sierra Leone, with over 9,000 deaths recorded to date. Yet recently, I'm sure you've heard and read that we're seeing optimism. Thanks to nationally and regionally led response efforts, case incidence has been declining as of late January. Public health improvements within the three countries, including safer burial practices, earlier detections, more health workers and treatment facilities, public awareness campaigns, and stepped-up contact tracing have also contributed to a lower risk of spread across the borders. However, the fight is not over, and we must remain vigilant until 0 new cases are confirmed. Within this ever-changing context, UN Women is working together with the rest of the UN system to respond to specific priorities and needs of women and girls, while at the same time recognizing and empowering them as agents of change. On the economic front, according to the most recent World Bank analysis, the Ebola outbreak is costing the three most affected countries more than 1.6 billion loss in revenues. As the virus causes their economies to slow down or shrink, this situation is likely to disproportionately affect women who are overrepresented in informal and precarious employment sectors. From a health perspective, women are at the front lines of the epidemic, caring for the sick and tending to the dying. But they're also the most impacted when already burdened health systems are further weakened by a crisis as massive as the Ebola virus. Women's reproductive health is impacted severely, and UNFPA last October reported that 120,000 women could die of complications in pregnancy and childbirth in the most affected countries over the next 12 months if life-saving emergency obstetric care is not provided. UN Women's gender response strategy to the Ebola outbreak includes women's participation and leadership, a focus on health care and education, sex disaggregated data, and identifying and addressing gaps in security and gender-based violence. Our response is based on partnership, and it's founded upon the importance of a collective approach in combating the Ebola virus through leveraging our normative, coordination, and operational mandate, as you'll hear from the colleagues shortly. We're working closely with government, the United Nations system, civil society partners, to ensure that both strategic planning and operational responses address the roles of women and girls. I'm now pleased to introduce Peterson Magola, UN Women Deputy Representative in Liberia, who will make a presentation, followed by Mary Okumu, UN Women's Representative in Sierra Leone. We look forward to your presentation, Peterson. Over to you. Thank you very much.
2, 1, go.
Distinguished guests, thanks so much for the opportunity to allow us to present to you interventions which UN Women Liberia implemented in terms of response to the Ebola outbreak in the country. As you might be following the current trends as of latest, you might have noticed that the new cases have significantly dropped in the country. And of course, now we are registering about 1 case every 2 days, which is a big difference as compared to, 40 to 50 cases which were happening during the peak of the outbreak. That's around between, September, October, November. Ladies and gentlemen, I would like to say that UN Women's intervention in this outbreak used a 3-pronged approach. The first one was on emergency and humanitarian response. The second one was and still is on early recovery, and the third one was on coordination and gender mainstreaming. On the humanitarian and emergency response, I'll just give you a few bullet points on what we have done. In the first case, we provided support to all women and girls who had been placed into isolation and treatment centers. And in doing this, we ensured that they are provided with the emergency emergency kits, such as sanitary kits. We looked at providing them with basic prevention materials such as chlorine. And also we supported them in terms of giving some dehydration materials, including water and Lucozade. These were materials which they immediately wanted to sustain their lives, and of course with support from our partners and donors, we were ensured to cover those immediate response during the outbreak and during the peak. And also we looked at supporting through our women networks, which are spread throughout the country, to ensure that they scale up for contact tracing. Of course, we knew that the only way this epidemic was going to be brought down was to ensure that every person who is suspected to be infected or is showing indicators of and symptoms of being infected could be taken to the to the isolation centers. And of course, through our women networks, we ensure that most of the communities are reached by these women groups. And of course, we saw that all these individuals were able to put into one place, and that's one of the areas we looked at. Still, under that period, we worked so much with the radio stations, with the mobile telephone companies, to ensure that there is social mobilization, prevention messages go out there, and of course through mobile telephone companies, we ensured that even text messages reach most of the people who were accessing who had mobile phones. And of course, radio programs continue to go on by support from UN Women. So that's also an area we looked at during the peak of the outbreak. Something which came out during that outbreak, that we had limited data on women. The data was not sex disaggregated. So working closely with the Ministry of Health, with other UN agencies, and with the civil society, we ensured that any data which is coming in from surveillances, from assessments, begin capturing the sex disaggregation. And of course, as of now, we are having now data which is sex disaggregated, and it's informing us on where to target our interventions. On early recovery, which is our second approach, we looked at ensuring that women whose livelihood and economic activities had been affected are brought back and revitalized. And through this, we worked closely, and we are still working closely with a number of agencies, including UNDP, including Oxfam, and of course other government departments, to ensure that women's access to cash transfers is promoted and it's implemented, and as well as working closely with some of the financial institutions to ensure that women have access to credit and loans. And also, we are working with the private sector currently. We are working with the private sector to ensure that market is being created for goods which are produced by local women entrepreneurs. This is an area which has been lagged behind, but also we are tapping through this current outbreak to ensure that women can have markets for their produces, both at the national level but also in the regional perspective. The other area which UN Women is looking at currently is to ensure that all the interventions integrate the survivors of Ebola and their needs into the whole spectrum of the response. We've recorded over 4,500 or more survivors in the country, and these need to be reintegrated back to the communities and provided with livelihood support. And working closely with, again, with other partners, we are supporting them to establish income-generating activities such as fishing, such as improved farming methods so that they can have better yields. But most important, ensuring that their skills are developed so that they become successful local entrepreneurs. Our work on coordination as the third prolonged approach is continuing. UN Women continues to be the chair of UN Gender Theme Group. And it's on that forum, it's on that round table that we discussed what the gaps are in terms of reaching women and children as well as girls, in terms of ensuring that they access the basic services, all food supplies reach them, and ensuring that the basic health services are being accessed by them. And at the same time, we co-chair the National Gender Forum together with the Minister of Gender, so that it brings all these different players on a round table in the country to again look at what are the gaps existing in terms of reaching women and girls, given the ongoing increasing cases such as on gender-based violence, on rape, and so on. So again, UN Women is playing a very pivotal role in terms of convening and facilitating these discussions. What lessons have we learned throughout this outbreak? One, it has really increased the further vulnerability for women. And on doing this, UN Women is working closely with, again, our partners to ensure that the underlying drivers of gender-based violence, of these traditional and cultural, drivers are addressed. So on that, we are developing programs which engage local leadership, which engage, civil society to be the agents of change and to lead the, the change process at the community level to address some of those structural changes. Also, UN Women have seen that the impact of Ebola has affected women much more than men, again, based on the, the gender roles and the behaviors and also power structures at the community level, which, again, we are working closely with the government, with the civil society, to ensure that, of course, programs are developed to reach women and also to change the status quo at the community level. And of course, we also look at ensuring that women, which of course has been manifested through this outbreak, have increased access to basic health services. And of course, through the decentralization process, we are supporting the government to ensure that these issues of access to basic health services, to education, and to livelihood opportunities are integrated within the whole of the decentralization process. And lastly, we've seen that the Ebola outbreak does not only look at the short-term issues, but also it has medium and long-term impact on the productivity of women. And of course, this is an issue we are looking at within the whole UN system to ensure that all the interventions and the responses and programs which are being developed look at both medium and long-term interventions to ensure that we address these issues which have been brought about by the outbreak. Lastly, I would say that, well, gaps still remain. We still have increased gender-based violence in the country. We have rape cases going on. And of course, the health services have been not scaled up to the level where women can easily access them. And we call upon our partners to continue working with us and support us in ensuring that we save a life of a woman and we ensure that that woman who has been violated accesses services. On that opportunity, I would like to sincerely thank our partners such as Germany, Japan, and Sweden for the continued support, and we really look forward to working together with you. Thank you so much for the opportunities, and that's all from my side.
Hello, my name is Mary Okumu. I'm the country representative of UN Women in Sierra Leone, and I'm happy to meet the board and our senior management in New York. I'm going to present UN Women experiences with the Ebola response in Sierra Leone. UN Women, to date, let me just add that 10,000 people have been infected with Ebola virus in Sierra Leone, of which 2,870 have died. UN Women's response to Ebola outbreak in Sierra Leone has a three-pronged approach. It has advocacy and sensitization, building national institutional capacities, strengthening and implementing targeted gender response to the outbreak in all the Ebola response pillars. In advocacy and sensitization, we have been able to ensure that the public education takes into account gender dimensions of the Ebola transmission and to ensure that women's participation and gender responsive education has been disseminated. And we have been part of the community sensitization, public sensitization. We have produced advocacy materials. We have ensured that the role of women, both in the transmission, but also as victims, has been addressed effectively. In building national capacity of institutions to respond to Ebola, we have worked mainly through the United Nations Country Team Mechanism. We have worked with the Line Ministry of Gender, and we have worked with the Office of the First Lady and civil society organizations in ensuring that the packages in case management, in contact tracing, in social mobilization, in psychosocial support have taken on board gender sensitivity. UN Women has been able to ensure that data which is disaggregated by sex has been systematically collected, analyzed, and has informed the response. And in that way, our third response area, strengthening targeted gender response, has benefited tremendously from the data that has been generated by UN Women in the response. For example, we ensured that the packages of Ebola response to households, quarantined households, for example, included firewood and water, included sanitary hygienic packs that could be used by women and girls in quarantined homes. Our response has also ensured psychosocial care and counseling to patients and to survivors. And we have also supported door-to-door campaigns which have been extremely useful in the response. What messages have we learned as UN Women? We have been able to understand that a coordinated response and ensuring gender responsiveness in all of the pillars, in case management, psychosocial counseling, contact tracing, and in logistics, have been gender responsive. Now, moving forward, UN Women, because of the pivotal role it has played in the response, we have been recognized as an agency that has added value in the national Ebola response. And to that extent, UN Women now is a key player in the early recovery efforts. The national multi-sectoral impact assessment on gender and on Ebola is what is informing the recovery plans, both at the UN level and at the government level. UN Women will continue in the early recovery interventions to support working with survivors, looking at questions of livelihood, support to female-headed households, looking at safety of schools for girls when schools reopen, and looking at livelihood support. We will also continue to work with the traditional leaders who have been extremely pivotal in bending the Ebola transmission curve. The role of traditional leaders will now be shifted to getting to zero and to early recovery, ensuring that female-headed households, first of all, continue applying the education on prevention of Ebola, as well as in playing a role in livelihood support, economic empowerment of women. In being part of the national Ebola response in Sierra Leone, UN Women has learned that gender-sensitive approaches, in fact, do make an important strategy and value addition to Ebola response. And so the gender analysis, the capacity ensuring that the national machinery has adequate gender capacity to respond and from a coordinated perspective is what we are going to continue. We are looking at scaling up the activities that we implemented in the emergency phase. We are now in recovery and getting to zero. And in that sense, we will be focusing a lot on working with survivors and affected homes. We have been able to be part of the frontline agencies, WHO, UNICEF, UNFPA, WFP, UNAIDS, and so we have consolidated UN Women gender responsive tools, which are now going to be taken forward under early recovery. And I thank the board this afternoon for giving us an opportunity to share with the board and senior management what UN Women is doing. And I just want to assure our board that UN Women's role in Ebola response has been acknowledged and appreciated. I thank you.
I want to take this opportunity to thank our partners for the strong support, without which our offices could not have responded to the national efforts and in implementing a gender-sensitive response to the Ebola crisis. I want to specifically highlight the generous contribution of the government of Japan with a donation immediately of $500,000, and the government of Germany, who provided funding in the amount of $510,000. These funds were delivered at a critical moment, and it allowed UN Women to ensure that we had the right people on the ground and at the right time to implement the initiatives that you have heard described by our representatives. UN Women also provided its own funds with emergency corps funding in the amount of $380,000 to ensure that our organization could be responsive and impactful in this emergency context. We're very pleased with what's been achieved, but there remains such a strong sense of urgency to do much more and implement recovery efforts, while also working to address medium and long-term impacts of this crisis on women and girls. This slide that you see up there on my right highlights the existing funding gap which we have, which is over $2.6 million in the implementation of the UN Women's Regional Strategy for response to the Ebola virus in West and Central Africa. We call on all of you to join this effort and look forward to a continued partnership in support of UN Women's work on Ebola response. Thank you very much for your attention this afternoon.